Clinical relevance or health conditions of this rarely talked about organ. I'm Ifeanyi and welcome to my channel. You see, many people don't even know that you live with an organ called the spleen. Look at the spleen like a vital organ that is rarely talked about. Now, the spleen is the largest lymphatic organ. It plays a vital role in the immune system. It is purplish reddish in color and it is related to the stomach anteriorly. Some of the functions of the spleen include: it is known as a blood bank. It stores blood and platelets. It destroys old blood cells. It functions as an immune defense. It fights infections. Now, using 1, 3, 5, 7, 9, and 11 to describe something about the spleen. The spleen is 1 inch thick. It is 3 inches wide. It is 5 inches long, that's the length. It weighs around 7 pounds and it is closer to the 9th and 11th rib. Now, health conditions of the spleen. Number 1, splenomegaly. Splenomegaly is the enlargement of the spleen, and this can be as a result of, or some of the factors, or some of the causes include malaria, typhoid, liver disease, leukemia, blood cancer, mononucleosis, blood disorder, and even HIV and tuberculosis. Symptoms: pains within the left hypochondriac region, fullness and early satiety. Now, before I write on, the spleen is located at the left upper quadrant, exactly the left hypochondriac region, that is the left upper region, is divided into 9 regions, 4 quadrants. The second health condition now is hypersplenism. Hypersplenism is when the spleen becomes too active, and in this case, too many blood cells are destroyed. It's a blood bank. Now, what are the causes? Anemia, low red blood cells or hemoglobin in the blood. Leukopenia is another cause, low white blood cells in the blood. Thrombocytopenia, low platelets in the blood. Platelets is meant to clot the blood or coagulation of the blood. It's our cells responsible for that. So when it is low, it leads to thrombocytopenia. From erythrocytes, red blood cells, leukocytes, white blood cells, thrombocytes are the platelets. Now, the next health condition is splenic infarction. Splenic infarction is when there's a loss of blood supply to the spleen. And embolism, sickle cell disease are the common causes. Symptoms: pains within the left hypochondriac region of the abdomen, that's the left upper region of the abdomen. Now, splenic rupture being the next one. This is a condition associated with a torn outer covering of the spleen leading to bleeding, and this is a very severe condition that requires an immediate or an emergency, immediate medical attention. And this can be as a result of accidents, maybe a car accident, or maybe as a result of sports injury, a collision or a fall. The common signs or complications include internal bleeding, yes, K-sign, radiation of pain to the left shoulder, and shock. And then the next one, let's say the fifth one, is asplenia. Asplenia is a loss or absence of the spleen. This could be as a result of trauma or splenectomy. Splenectomy is a surgical removal or excision of the spleen. And this can increase the risk of infections, very severe infection, especially those caused by the encapsulated bacteria like the Streptococcus pneumonia, Haemophilus influenzae, and the Neisseria meningitidis. That's why doctors usually give vaccines to prevent further infections. Now, what are those examinations the hospital normally do? They do physical examination, palpation for enlargement. They do blood test, CBC, complete blood count test, or the blood smear test. They do imaging diagnosing. They could do using a magnetic resonance imaging, using a computer tomography scan, using an ultrasound. If you find this video educative and helpful, please like, share, and subscribe, and I'll see you in the next video.